Told you it was a busy old show today. We're talking about oral health next. Dr Ben Atkins, president of the Oral Health Foundation, on the line.
Hi, Matt. How are you?
I'm good, thanks. Thank you for coming on and chatting to us. This research you've sent us about people's oral health, people having dodgy teeth because of lockdown. Tell us more.
The research done by the Oral Health Foundation and Invisalign have really noticed the fact that the Zoom effect has really affected the nation's knowledge about their smiles and their crookedness. So people are recognizing that oral health is really, really important, especially, we've timed it very well, coming out of lockdown as Smile Month is kicking off.
I mean, is this because people have been more aware of people's faces because they've had the Zoom calls, or is it the fact that people haven't been able to, or maybe people have been nervous about visiting the dentist?
No, I think it's the fact that their face has been speaking to them back to their computers. So when you're on a Zoom call, your face is in the top right-hand corner and you keep looking at them thinking, oh, my teeth aren't quite looking as good as they were. So I think people just started to become a lot more self-aware of their smiles rather than nervousness.
And we're seeing the likes of Instagram, aren't we? And the social media platforms, they're gaining in popularity. And it's all about looks, isn't it? It's all about first impressions at the moment.
I think, yes, I think it is that first impressions. And if you think about when we've been walking down the streets, we've been seeing people we recognize that we know, but we've not been smiling at them because we've been hidden behind masks. So people are suddenly becoming a lot more aware of their smiles. And the research that the Foundation and Invisalign have done has showed that. So people are now coming back to us, the dental practices, to say, what can I do? And the really exciting part is we're giving that opportunity to talk to patients about prevention, about stopping dental disease, about making the teeth straighter, about making the teeth easier to clean, and having those conversations to stop any dental decay, because realistically your teeth should last a lifetime. Now, dental disease is fully preventable, so brush your teeth twice a day with a fluoride toothpaste, visit your dentist as often as you recommend, and reduce the frequency of sugary snacks can make a massive difference.
And if anybody's got problems with the teeth and they want that Hollywood smiley story, I mean, things I've seen on the internet these days and looking at various procedures, the cost of repairing a smile and getting those perfect gnashes definitely seems to have dropped. It's affordable to everybody these days, isn't it, almost?
I think everybody can have that smile that they want. However, it's even cheaper. Save your money by brushing what you've got. There's always a joke in the dental profession of brush the ones you want to keep. So for me, it's really important. Visit your dentist, speak to them, look at how you want to look like in the future. By preventing dental decay, preventing gum disease, you can make such a difference for the lifetime of your teeth. And yes, dentistry is getting more affordable to everybody these days.
And how often should we go and have a checkup then? What's the recommended frequency between going to see the dentist?
The good thing now is it is totally variable. So patients with phenomenally good oral health, I can see them every 2 years. Patients who've got bad oral health and eat all the sweets and do not brush their teeth correctly, I'd like to see them every 2 weeks. So it depends. You must go and speak to your dental practice and say, look, how good is my oral health? If it's really good, fantastic, we can push it out. A lot of patients then come back in the meantime to get stains removed and their teeth cleaned and that sort of stuff. But in the meantime, seeing your actual dentist is different these days. So have that conversation with your dental practice to make sure that we can tell you what you need to do.
And if anybody wants any further information, what's the best way to get that?
The best way to get that, the Oral Health Foundation has a website in Smile Month called dentalhealth.org. We also run a charitable website called safebrace.org, and that's run with the British Orthodontic Society. And it's a campaign to provide education to patients about what they should be doing. And also there's also the Invisalign website. That makes a lot of information for aligning your teeth.
Brilliant. Well, thanks very much, Dr. Ben Atkins. Thank you for coming on and chatting to us. You have a good day, and we'll speak to you again soon.
Remember, keep smiling. Thank you.
Thank you.
Getting to the heart.